Recorded. I want to thank again Aspirus for their sponsorship of this program, and Sam and Donna, our speakers this morning. Todd Kukan, our Executive Director, is here. Todd, would you like to say a few words of welcome?
Oh, you know the answer to that, Karen. You're so
That would be
polite
a
and
yes.
ask, though. No, I just want to welcome everybody. Aspirus is a great partner of ours, a great member, besides being a good neighbor of ours, just a block or two away here in the business park. So great to have them on board. And Sammy and Donna are doing a lot of great work in this area. Obviously, very critical as businesses are opening and reopening and trying to figure out what the heck do we do with all these different issues out here. So I think you'll get some good advice from Sammy and Donna, and make sure you check out all our other events. We're starting to do some live, some by Zoom, and some mix. So we're trying to do our best to be smart in this COVID area too. So thanks, Karen, for letting me say a couple words.
Thanks, Todd. And it's my pleasure to introduce our two guest speakers. We have Samantha Diedrich, the Sales Executive at Aspirus Business Health. Donna Owens, the Director of System Business Service. So Samantha and Donna, take it away.
Okay, well, I'll just get started. So thank you very, very much for the great introduction and for inviting us to actually do the presentation today. So we're very pleased to be here. Our goals for today is truly to introduce this program to anybody who's had the opportunity to listen in today. Karen, thank you for recording it so that if others were not able to find time today, they can catch up with the program as well. And then we're going to talk about some next steps, and Sammy's going to join and just let you know how we can get started to help you if indeed there's some resources or tools or anything that we might provide. So the Work Well program from Aspirus really is representative of our commitment to employers in general. But in this time, this challenging time that all of us are working through together to provide a couple of things. First of all, to make certain that we are helping all of you as employers and your employees safely return to work and to our communities in general. That means those essential businesses that have continued to work over the last couple of months and have already figured a lot of things out. They've dove into the guidelines and put in a number of safety practices, but maybe need to just review a checklist again, confirm they've got everything running smoothly, or maybe they need some new ideas. And for those businesses that now are coming back to work, or maybe just in the last few weeks have come back to work, we're just here to help provide guidance to all of the right resources, to make recommendations, and simply to help you get back to work. So part of that commitment, of course, is providing access to those resources. There's hundreds and hundreds of pages to wade through, and we've done that work for you. And then also to confirm that this entire time, our occupational health departments in every one of the communities that we serve has stayed open, and we've actually been very busy helping those essential businesses make certain that they continue to have safe hiring practices and a place to go if indeed the unfortunate employee maybe was injured or needed some specific treatment. So we've been there and we're committed to continuing to do all of that. So our goals for the Work Well program from Aspirus are really the same goals that everyone has for their workplace. First of all, how to support your workforce. They are your greatest asset, and how do we make certain not only that you're supporting them, but you're preparing that workplace every day with their safety at the highest level of priority, protecting that workplace. And then for many of you, it could also be thinking about your visitors. So your visitors may be occasional. It might be a delivery person or someone else coming in for a meeting or discussion, or you could have an active customer stream. So many of you are going to have other things that you're considering in your workplace beyond your workers, but also your customers. So we're here again to help provide that guidance, those best case examples, and the right tools and expert advice to use. Our Work Well program has really 3 levels of services attached to it. I call it kind of the 101, the 201, and the 301, because they almost grow with your own workplace strategy. So the 101 part of it, I'm going to show you a few more slides after this. That's really about providing a one-stop shop for access to all of the information, guidelines, checklists, safety tips, posters that you might consider as you look at your workplace and you think about what to do next. So what we've done is we've dove into all of the expert guidance from the CDC, from OSHA, from the Department of Health Services, from the WEDC, to say for employers, they're really getting an avalanche of information from multiple parties. How do we take those expert guidelines and put them in one place, dive into the hundreds of pages, and create the link to the very specific guidelines and tips that you might be seeking, and give you that one-stop shop. So we're going to have a few screenshots of what that looks like today, and then at the end, Sam's going to tell you how you can get to that one-stop shop of resources we've created. The 201 that we also have created tools around is for any of you that are thinking about temperature screening at your workplace. We've created 3 levels of service. One is a self-use tool. So you may already be doing some temperature screening. Maybe you want to make certain through a checklist that everything you're doing is correct and appropriate and what would have been advised to do. Maybe you're just getting started. You're pretty confident that if indeed you had a tip sheet about where to put your screener, what equipment to buy, how they should be using the equipment, we've created those tip sheets and you can just grab them and use them yourself. We also, though, offer all employers, whether you've worked with us in the past or whether you're just newly considering something that we might support you with, that we're happy to train your staff to do this as well. So we'll come on site, help train you to do it. We could do a webinar, help train you how to do it. But we're here for you to really help you with this element of potential workplace safety you may be considering or already doing, and you just want to confirm you're doing it right. And then the 301 we're going to talk about briefly today is for employers who are also potentially having their employees review every day before coming to work whether they are having any of the COVID-19 symptoms. So there's a number of different ways to get that done, and today we're going to introduce a new way that we're actually starting to pilot next week. So we'll have available to employers to consider using within the next couple of weeks. So very soon, a great new way to do that that's very efficient and easy and provides reports. So kind of the 101, 201, and 301 of resources for workplace safety. So in that 101 version, to get to our tools, it's really going to our Aspirus website, to our business health section, where there's a laundry list of all of the different services that we provide through our Aspirus Occupational Health departments. But once you're on this website, it now also guides you to our WorkWell portal of tools. So I'm going to take you right there so you can see what this looks like. It's not live, so I can't open anything up. But again, Sam's going to tell you at the end about how she's going to get you access to these tools. So this really is that one-stop shop where we have gathered together all of the things that you might be seeking and thinking, I heard about this, how do I get to this? How do I get to the space that's very specific to employers? And this is where we've created all of those links and grabbed all of those tools. So you'll see the blue box is start here. Our recommendations truly for every employer is to start with the very first bullet point there that says the safety practices checklist. And what we have done there is created and grabbed from all of those experts what are the major things that they are advising every employer think about. And many of them have become, who would have thought, part of our common language now. Who thought about social distancing 6 months ago? We probably would have said, what's that? Now we know exactly what that is. So this checklist, though, walks you through all of the things. Some of them have become very familiar, common sense, hand washing techniques, what kind of hand sanitizer to buy, social distancing. And then it gets into some of the things that employers might have still been thinking about or maybe isn't on their radar yet. And those are things about, travel policy, or are you going to stagger your breaks? Have you considered your ventilation system? The recommendations right now for ventilation systems are a little bit more aggressive than the normal practice of changing your filters, etc. So this safety practices checklist gets you started with, have I considered all of these things? And if you have fantastic. If you haven't, it prompts you then for something that you may want to do a little investigation on. And that's what these other tabs are about. This is going to get you specifically to that link, that tip sheet, that checklist that we maybe have created as a summary, the link to the very specific guidelines, and posters that we've created to just help you in that workplace so you don't have to start from scratch. We aren't the experts, we're the guide to the expert advice, and we're happy to even help walk any employer through this if indeed they're just really walking through that checklist and like a guide to walk through that with them. Everything I've talked about with our program so far, including walking through this or consulting with you via webinar or even a walkthrough at your facility, is at no charge at all. Regardless of whether you've worked with us before, we're here to help you, and we're here to help you really review and make certain that you're thinking about every one of those workplace safety guidelines and then applying those appropriately based on what you want to move forward with and what you think is critical to your workplace. The posters, we've created posters. I'm going to show you a snapshot of several of them. Often what we found in the guidelines, even from the CDC, which are wonderful guidelines, or the WEDC, where they've taken and created guidelines based on business type. They're really wonderful guidelines, but they often will say, and then you should put up some posters, and then you should do some screening. So what we're doing is filling the gap in where it's advising you to do something, but it doesn't tell you how to do that. So what we've done is taken those gaps and filled them. So if indeed it says you should have a poster, well, here's 8 or 9 different versions of posters that you might consider. Again, they're free. We'll print them for you. We'll deliver them to you. We make them in 8.5 by 11. We make them in 11 by 17, but they're all things that we're happy to deliver. If you don't have a color printer or you're working from home right now, we're here to help you make certain you can get this started in an easy and efficient manner. Just truly here to help. These are all of the different areas, again, that you're going to find on that checklist. They've become very familiar to all of us, but it helps you dive into any of these and really examine, have we thought of everything? Do we have the right cleaning products? Do we have have we identified the areas that need to be cleaned regularly because they're commonly used all day long by multiple parties? If you're bringing employees back to work, have you given them instructions about cleaning their workplace before and after the workday? So many, many tips and ideas here. We have in the last couple of weeks, as we've introduced the WorkWell program, talked to hundreds of employers. We've consulted with about 50 employers. And regardless of where we have gone, there's always something that could be added to the thoughts that they already have about their workplace safety. So we're here to help. And of course, now we have many, many other examples from employers that we can share as well, just to make certain we help you move forward. This is just a snapshot of some of those posters. We've tried to make them very colorful. If you've already been working and you've put up posters previously, we all know people kind of get poster fatigue. They read it once, maybe they read it twice. Now they don't even look at it anymore. It's become part of the wallpaper. So even for people who say, I've got lots of posters, we're good, some fresh posters might be interesting to your employees. They might reread that message. There might be one extra tip on these. Again, they're meant to be colorful, easy to read, engaging, a refresh for those of you who have them, an easy way to get started for those of you who do not. And again, these are all free. You can grab them and print them yourself. But again, we're happy to print and deliver as well. So again, a reminder of what are all those important links we went to, same experts and guides that you've been going to, but what we've done is dove in deep, grabbed the critical links for employers, and added those to that WorkWell website. So temperature screening, again, as I noted, we really provide several levels of service here. One is just tip sheets if you want to do it yourself. So another just confirmation that you thought of everything and you've got the right stuff. Your employees know how to do it if you're going to do it yourself. We are happy though to walk you through that. You know, there's certain things to always consider, confidentiality being one. We certainly wouldn't want a temperature screener yelling out everybody's temperature as they walk through, but instead maintaining some level of confidentiality while letting the individual know they're ready to proceed to work. If they're interested in their temperature, letting them see visually what that temperature looks like. Certainly we're advising to use thermometers that are the point and screen versus ones where you're actually going to have to touch people. You want your individuals masked. They're going to be close to that screener. The screener certainly has to be masked. Those are the kind of advice and guidance that we can walk through, either again via webinar or an on-site discussion. And there's no charge for any of that. If though you're interested in us potentially supporting you with some staffing for on-site screening, that is another option. It's really based on availability, but we're happy to have that discussion and find out if indeed we can match up schedules and do that. It's one of the only points where we actually have fees for any of our services. So that is a check-in with us. We've kept that staffing screening fee very low, $40 an hour. If you have multiple screeners, we can talk about adjustments to that as well. So that is a possibility if you're thinking about, boy, I have, you know, especially for employers that may be having a larger number of employees come through at the same time of the day. It might be a combination of your staff, our staff, helping you get that done. It might be even a transition, starting with some of our staff while we train your staff to do it long term. We're open to explore all of those options to support you. And then the last thing we're doing is in our hospital in Wausau, we actually have set up some of the camera digital temperature screening equipment. As you can imagine, we have a large number of employees and we have a large number of guests, visitors, and patients coming through that door every day. So those kind of tools are a little bit more expensive, but we are testing it to make certain it's effective, that it's accurate, and for any employer who's looking at using a temperature screening tool that might involve customers as well as employees in larger numbers, we are happy to reflect, we're happy to demo what we've used, we're happy to put you in touch with the vendor that we've used as one of the options that you might be considering if that's something that you need to do. So the last area that employers are really looking for information on is symptom recording. So the guidelines have certainly led us all to consider that our employees at least think about and confirm on a daily basis that they don't have any COVID-like symptoms before they're reporting to work. Many employers are starting to do that in person. It takes quite a few minutes. The list of symptoms has expanded from the original 5 or so to about 10. So it takes a few minutes if it's being done in person, but that's certainly an option. And we've got the form with appropriate questions on it. Again, happy to provide, so you can check in and make certain you're asking all the right questions. A second option that many are doing is paper. And again, we've got that paper form. We've heard from some employers, they've created kind of like a work week form. So an employee can sign each day, handed it at the end of the day or end of the week. And that's absolutely an option. Again, we've got the questions to make certain the right ones are being asked. The only caution there is what we have heard is from all the appropriate regulatory bodies is if something's on paper, this is a employee health HR level paperwork that then has to be secured and stored properly. So it can't just be a pile of paper that gets thrown away one day. Now you've taken information from your employee that may have to go into their file, or certainly in some kind of group file that is secured as their other employee information is. So just a thought about paper, that's just one of the things that has to be done with that. So coming soon, starting next week in pilot, an electronic employer symptom reporting tool. So we'll be introducing that again. Next week is pilot. We want to make certain we're using it on a couple of our employers who raise their hand quickly to test this with us. We ourselves have been testing it on our own 9,000 employees over the course of the last month, and it's working fantastically. So essentially the way it works is that instead of that paper or those in-person questions, we actually would be providing the employer with a link that their employees can then download to their computer or their phone. It's not technically an app, but it looks like an app once you store it onto your home page of your phone. And then each day, the employee then would have the requirement to hit that button on their phone or their computer, and they would then be asked those questions right on their phone. If they do not have any of the symptoms, they simply say no and submit, and they are told they're good to go to work. If they say yes to any of the symptom questions, then their phone will prompt them that you need to follow company policy for having a symptom today. And that company policy, of course, would be developed by each company. We're happy to help you with that. And that could be either go to your primary care provider, call the Aspirus COVID-19 nurse hotline, which is another free service, and get assessed. And some of the symptoms today, somebody might indeed feel tired that morning. That is one of the symptoms. The nurse assessment could pretty quickly tell them, well, you've got a couple other things going on. Let's wait till you have another symptom before we send you for testing. Or they may have indeed woken up with a sore throat, a headache, and a cough, and we're going to send them through that nurse assessment line, and they're probably going to end up having a test that day. The good news for you is that testing now happens every day, and quick testing options continue to expand. So also within the next week, Aspirus will be announcing that they can do far more tests with results within 24 hours. At the longest, if a test has to be sent out, it's a 3 to 4 day turnaround, which means today, and we all know the policy we've been following for the last several months, was if somebody had symptoms, we send them home for 14 days. We never actually probably knew if they had COVID unless they got to a place where they were hospitalized or were in an at-risk situation because of the, not because because people didn't want to test, because there just simply wasn't the equipment or the supplies for testing. That no longer exists. Now we can get them tested. Certainly if they're positive, we're going to then confirm the appropriate 10 days off work, 3 days, at least 3 days post symptoms before they can return. But if they're negative, you now have a quick confirmation, and your employee health policy for return to work after illness, because something would have put them off work, applies, and you can get them back to work. So the good news is an electronic employer e-tool leads you to some quick results, leads you to updates and confirmation in your COVID return to work policies as well. The other part of this tool that is a feature for employers is that there's 2 levels of reports that the employer will get every day as part of this electronic reporting. One is a compliance report, because certainly if you're going to engage in this tool, you want your employees to be taking it seriously, and you want, our goal would be 100% compliance every day. Somebody's going to forget, or somebody's going to be on PTO. But the report that the employer gets will show them a trend report on compliance. So say you have 50 employees, and every day somebody's going to forget. We're also going to give you, we don't ask you for any personal health information on your employees, including even their names. We ask you for a unique user ID. typically their employee ID number. We're going to report back to you that employee ID number 123 did not attest to their symptoms today. They did not do the electronic reporting tool. That allows you to confirm this person is on PTO, or, oh boy, this person seems to maybe they didn't do it for 3 days in a row. Maybe they've forgotten. Maybe they need to upload it again onto their phone. Some kind of reminder needs to happen there. So you can manage the compliance portion of your tool to make certain the second report you get is a good and valuable tool, and that is how many reported symptoms on a daily basis. So again, the example of 50 employees, you get a report every day that says you had 2 people attest to have symptoms. Here are their user ID numbers, and you can quickly confirm, did they follow our policy? Did they call their manager? Did they call human resources or employee health? We know that they're in the process of getting an assessment. We'll hear from them, as soon as we have more information, but you're managing your population and you know who attested. If indeed you have an ID number and they did not follow the process, you might have somebody with symptoms who ignored policy and is now in the workplace. So you're going to want to go and talk to them and make certain that they didn't misunderstand the questions or the policy. And then, again, you're being able to manage that. This tool, though, will also give you the trends for the number of employees you normally do see with symptoms every day. And so the possibility is there that one day, and we're starting to see this happen in all of our communities, you suddenly have not your normal 1 or 0 or 2, but you have 7 employees today that have symptoms. And when you look at the ID numbers for those, you realize they're all in the same department. Now you know you've got a red flag. Now you're very carefully going to assess where they are in the assessment process to make certain that you don't have the potential for an outbreak. And that would allow us to call in public health. We can help you with the cleanup. Public health certainly will provide all of the wonderful guidance that they're experts in being able to provide, but alerted you very quickly that you had a problem versus a few days later, you're going through the paper and now you realize that something is amiss. So these are tools really to help you with compliance. It's about giving your employees an easy way to get this done, something they just become very familiar with doing. It's not something that's creating a burden for them. And for you, you can manage data. So this tool is coming soon. We would propose even providing back more information, Karen, for your chamber members in the next couple weeks, some more details about how this works. It's the only other feature that we have that has a fee attached to it, but it's very small. It's $7 per employee per year for the tool. We ask for a year-long commitment because we truly believe it's going to be a year from now before we're all ready to not potentially look at symptoms on a regular basis. And a minimum fee of $300. So if a smaller employer wants to participate, there is some implementation cost. This is really only about us passing through the costs from the national consultants who've helped us build this tool. So really they're meant to provide you with better information, efficient, easy to use for your employees. These are all the symptom questions that are now being asked about, we've become familiar with these as well. And in many cases, remember, part of that symptom question is, and not related to an other current issue. So if somebody is fatigued, but they've got a newborn at home, we wouldn't expect them to say yes. We'd expect everybody to be wise and consider a symptom they have that is related to some other issue and not every day be reporting, I still have that cough because of my allergies that my doctor has confirmed I'm in the middle of, unless they start to get a combination of these. We can help with that kind of policy too, to help you make sense of that. So we've got good examples of company policy. So the other thing that this really does is provides us with an alignment with the ability now to test, with an update of your policy, with a way for you to manage the individuals who are in testing, and to make certain that you've got access to good resources, no cost. You've got testing happening so you can get your employees back to work. If it is a positive, we can all align and make certain that the appropriate testing and cleanup and back to work is happening as well to create as little disruption as possible. So I'm going to pass it to Sam to really talk about, now that you kind of have an overview of the 101, 201, and 301 we can provide. She's going to talk about how you can engage if you're interested in learning more and how we can help you.
Awesome. So thanks so much. So I'm Sam Diedrich. I'm the sales executive with Aspirus Business Health. So what are the next steps for anyone on this call to get engaged with this program, to start participating and using the resources right now? You could right now go on the website. You could go on to Aspirus-Workwell, and you can scroll down to the bottom and you can register yourself too. That's an option. Otherwise, following this call, I will be in contact with anyone on the call too, and I'll get you the passcode to get you onto the website too. So I'll follow up with you directly. And then you also have my contact information. Should any questions come up, or you're looking for any further detailed consulting with one of our occupational health experts. We have experts in each of our regions. In the western part of the state, eastern part of the state, we have northern part of the state up in the UP, and then right there, basically across the street from your Portage County Business Council office, we have experts in that office as well. So we can get you set up with someone to work with you, either maybe over the phone. They can come on your site and walk through and kind of see, are your processes good in place, that are in place. One thing we've been doing too with some of our Occ Health team is we've had some companies that have the process in, they have the paper written out, but they're not sure, is the wording right? Is the messaging right? Are they saying the right things and using the right vocabulary? So they've been sending actually their written policies to some of our Occ Health team members for them to just kind of give an eye over and an opinion on. Otherwise, you can call or email us directly to businesshealth@aspirus.org. You can call me directly at 715-847-0021, and I'll be happy to chat with you over the phone too on some details. Like I said, I will be following up with you with the access code for the website. So that access code is really what's going to allow you to get those checklists. The checklists are fantastic for especially a company that might have already started implementing some of these. So if you're looking kind of for a gap analysis on what are you missing, you know, what maybe do you need to add or improve or do better, that's what that checklist is really great for. The tip sheets are fantastic for all of those different organizations, from OSHA and the Wisconsin manufacturers. They use big words, lots of jargon. You know, if you're not in the medical field, some of that is very overwhelming. So our occupational experts have made it easier. They simplified it. They made it more understandable for everyone to understand these policies too on the tip sheets. The links to the resources too. As an HR representative, maybe you're looking for some support on your policies and you want the physical resources and you want the backing of your claims on your policies. We have links to those resources as well to help support you as an HR professional or a leader in your organization. And then, like we mentioned many times, the customize or the posters that you can customize the size on for your organization. I just dropped a lot of posters off yesterday. Employers were so excited to receive these and start putting them up on their businesses. They'll put them anywhere from maybe the main entrances where people are coming in, if there's checkout counters, if there's restrooms or any type of like public gathering space or a waiting room. Those are the types of places that I'm seeing them getting posted, and they look really good. They're nice, they're visually appealing. And then that phone consultation or site visit with our Occ Health experts. We have a really, really great team. They are so well versed in the practices and policies, and we have worked with so many different industries, from community libraries to universities. We've worked with organizations in the UP of Michigan and organizations that are south of here, down by our new Divine Savior Clinic in the city of Portage, south of you guys even. So there's been a lot of different experience that our OC health experts have had with so many different industries and so many different policies. So they're really willing to help your industry out, and they really enjoy it too. It's something they look forward to, is scheduling these meetings. They enjoy going, being right on site at your business and seeing what are you doing. Are you putting tape on your high touch areas? Are you using plexiglass? And they're just anything that's been coming up. You know, what type of countertops are you having? Does that affect your cleaning solution? Do you have plastic? Do you have fabric on your chairs, or do you have metal chairs or wood chairs? All of that affects the types of processes that you're putting in place. And like I said, our OC health teams are really going to be the experts on that. And what's really great about our organization at Aspirus is we get to pull in from so many different experts. We have our infectious disease experts. We have our environmental services and cleaning experts at Aspirus that we can tap into with questions. So if something were to come up that maybe someone in our business health department and our OC health teams don't know, we can tap into our other experts at Aspirus too. We're all working together on this to help support your business and your needs at your business. The next thing I was going to move into was going into a Q&A, but we don't have any questions in. So I think what I'll do is, we have a common question that always comes up to us, and it's usually, is most of this really free? And I'll kind of let Donna answer that and just reiterate the pricing.
The answer is yes. So really there's only 2 points of fees right now, and maybe 3. The first one is if indeed there's some support needed for actually staffing screening. So that is one possibility. We have a couple employers who have asked, we've done a consultation with them, we've done a site visit, and then they want to engage in some more comprehensive consultation. So that also is something where we create a proposal for additional time. It's only a handful really out of the hundreds of conversations that have needed that additional consultation, but that's an option. And then it's really about the electronic reporting tool. And again, $7 per employee per year for an entire year of daily reports and access to a very efficient, easy to use tool that allows you to manage your population, as well as just make certain that your employees are thinking about their symptoms before reporting to work. Again, a minimum of a $300 fee for the entire year, but so it's a very inexpensive thing for, you know, there are tools being sold nationally that are similar, that are tens of thousands of dollars, and they are doing the same thing. So we are happy to be able to introduce that. And again, we'll have more details, screenshots of what it looks like for any company to think about if this is something that they want to engage with. So yeah, that's really it.
Donna, Sam, thank you. Thank you again to Aspirus for your sponsorship of this program. Wonderful, great information. Thank you for all that you're doing, for your expertise, for your team's expertise. Businesses, take advantage of these services and share that information with your colleagues, your associates. Todd,
Karen?
what would you like to add?
Well, I was going to just ask you some questions. So we have an event on July 15th, correct? Women in Business?
We do.
And who's sponsoring that event?
Aspirus.
Oh, Aspirus is. Well, imagine that. So if you're too shy to call or email, even though Sammy and Donna are pretty nice people, you can come to that event, and I'm sure they'll probably have some materials there or some more information as well on how to help your business. It's, you know, some of the risk and some of the liability that you hear out there that's going on, it makes it a little scary, but I think this is a great program. There's a lot of great programs in our community, but this particular one is a great program to help you really get, you know, do the best to mitigate risk in your organization and help your employees and your customers. So I'll just pass on another thank you to Sammy and Donna, and we'll see you guys on the July 15th as well.
Thank you.
Thanks, Todd. And thanks everyone for your feedback in the chat. Sam and Donna, again, thank you. Everyone have a great day.
Thank you.
Thank you.
Bye-bye.